Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different topics related to plastic surgery. Our next topic, gynecomastia.
This one's for the men.
This is for the men. Now, first off, though, is it hard for men to go see a plastic surgeon? How does that work, and what's a good advice for the men who need to go see somebody?
No, it is. It's something usually that bothers folks since about puberty. Usually puberty is when things start. And it may get better over time. So if I see someone who's 13 years old and just started, it's probably worth waiting a year or two, letting things settle down. Because about half the time it'll go away.
Oh, it will? Okay.
Most of the guys I see, they're in their 20s, 30s, even older, and they've been dealing with their whole life.
So what is gynecomastia for people that don't know?
So gynecomastia is male breast enlargement.
Okay.
So
and how does that happen in men?
It's a natural part of what happens. It's like we don't know how it happens in women or men. You know, it's the hormones. And it's not like the hormone levels are usually off, though there are some syndromes that can cause it. It's a normal level of hormone, but the receptors in the breast are hypersensitive. So the breast develops a little bit, and sometimes it's just a little nub right underneath the areola. Sometimes it's a larger area of the chest. And depending on where it is, how much there is, gives us an idea of what we need to do to fix it.
So men pretty much know, I need to go in and get this fixed.
And you know, if there's guys who have it, it doesn't bother them, they don't have to have it fixed.
Okay.
But if it's bothersome, there's the option.
And so what happens in a gynecomastia procedure?
So if someone has like a little nub right underneath the nipple, we call it a puffy nipple.
Okay.
Usually what I'll do is make a small incision from about 4 to 8 o'clock along the areola, which is the colored skin around the nipple, and go down to where that lump is and remove most of it. I can't remove all of it because it'll make a dent. But I remove just about all of it and leave just the same thickness that's available or is present on the rest of the chest. So that when we're done, everything's nice and smooth. And
that's the only scar they have to deal with?
Yeah, if it's that small area. If someone has more fatty tissue elsewhere on the chest, sometimes I'll do liposuction in conjunction with that. And that requires usually about a 4 or 5 millimeter incision. Often I'll put it up in the armpit so it's hidden.
Oh, that's nice.
Yeah, it works very well.
Men don't like downtime. They really like to go see plastic surgeons. So
no, and
it's
sort of like a muscle workout. So,
so they're a little
most of the time, first couple of days, pretty sore. You want to take it easy. If you've got a job with a lot of heavy lifting and such, probably need to take the week off. Because you don't want to get extra swelling or potentially bleeding or complications.
But not a bad operation. Let's go to the pictures.
It's a pretty straightforward operation, and especially when it's a smaller area.
Easy to do.
It's easy recovery. So here's someone with a smaller area. So you can see the shadowing underneath.
Oh, yeah.
There's kind of a little bud.
Okay. Was that the lump one?
Yeah, so that's a lump one. He was bothered because even in clothes, it kind of made his nipple and the chest stick out, and he just wanted it smooth.
And it's probably uncomfortable in shirts.
It can be. The nipple can be
running
rubbed and rubbed.
Yeah,
sometimes actually they'll come in a little raw at the end of the nipple.
Exactly. And this fixes that too, if that is a problem?
Yeah, it smooths everything out. And if the nipple's big, the nipple itself can be reduced also.
Okay.
And done at the same time. Same thing here, and you can see more on the far breast that it's more of a cone shape rather than that rounder shape that we associate with a masculine chest. So same thing, just remove that.
Just remove. So no liposuction on this one. You just had to remove the lump. And I don't see scars anywhere, so that is fantastic.
The scar is there. It's right from 4 to 8 o'clock. It's right along the bottom of the areola.
Looks great.
It's hidden.
All right, next picture.
So here's when I did a combination.
Oh,
so
you did a little
can see
liposuction?
he's starting to get extra skin where it's really starting to sag and droop. But in this case, he's young, and the skin has good recoil. So in removing the lump, you can see the lump making its own separate contour of the chest, and then doing liposuction to smooth out the rest of the chest, it actually works out pretty well.
The nipples look different.
Don't they look different? They look different color and smaller. It's because they're not being stretched out by that tissue.
Oh, okay.
So I didn't tattoo it, I didn't do anything.
Oh, I know, I'm like, that's great.
It's just when it shrinks, it becomes darker.
Oh, wow. All right, another picture.
And then here we're almost getting too much
Almost getting there, yeah.
But again, in this case, liposuction, resection was enough to
bring things up.
Yes,
and then okay, very cool.
When it starts to really sag, so when the nipple's well below the fold, then I have to put a scar underneath the chest to remove that extra skin. It's kind of like doing a tummy tuck on the chest.
Yeah, and I still can't see that, but it looked pretty good. Last photo.
So here's a guy, I think I did both in this one too. But sometimes in the cases like this, I can just do liposuction.
Yeah.
But in his case, there was a fairly hard area of breast tissue that doesn't come out with liposuction.
Very good.
So again, the incision is down along the bottom.
And you know, men, what else do they come in for, if not gynecomastia?
Men, gynecomastia, eyelid surgery, nose surgery, liposuction. Probably the most common ones.
They're coming in more and more. Am I correct? Or
I don't know. I've always seen quite a few men, so I haven't noticed the difference. But everything I read says they are.
Yeah, I know.
but I guess because I do a lot of gynecomastia surgery, I do have a lot of male patients. So.
Yeah. Okay, good job. All right, for more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. Fantastic. We've got lots more coming up on Body Beautiful. What's next? We don't know. Stay tuned to Body Beautiful. We'll be right back.